Hello, and welcome to Breast Cancer Conversations, a podcast brought to you by SurvivingBreastCancer.org. I'm Laura Carfang, breast cancer survivor and founder of SurvivingBreastCancer.org, a nonprofit organization providing community, education, and resources to empower those diagnosed with breast cancer and their caregivers from day one and beyond. Hello, it's so great to be with all of you today. For those of you joining us for the first time, welcome. For those of you who tune in each week, it's great to have you back. I feel compelled to provide you with as much information, support, and resources as I can through our show, our interviews, and my own personal experience with breast cancer. The interviews and connecting with all of you is the fun part, but there is a lot of sweat that come with the relentless hours of post-production and editing we do each week to bring our podcast to life. I have to give a shout out to our newest sponsor, Podigy. We all wear many hats, and I think most of you know that I am no exception, hosting the podcast, running a nonprofit, and working a full-time job. But my heart and soul could not be more passionate and committed each week to delivering inspiration, hope, and support. That's why I've made the decision to team up with Podigy. If you have a podcast or thinking about starting one, I highly recommend them. They are super easy to work with and are offering our listeners 25% off your first month when you mention Breast Cancer Conversations. We know cancer takes a village, and I'm glad to have Podigy part of my support team. I'd also like to thank our Patreons of the podcast. Patreons are folks who listen to the podcast and support the work that we do by making monthly contributions through Patreon. Patreon is a platform where you sign up for these monthly contributions, and in turn, you get access to exclusive benefits. If you would like to be part of this community, go to breastcancerconversations.org/support to sign up. In this episode, we have the pleasure of speaking with Dr. Van Londen. I know you all are going to love this conversation. It literally is your personal one-on-one consultation with an expert in managing life after a cancer diagnosis. At one point, I share a personal example in the conversation, and Dr. Van Londen says that I am grieving. We all have these powerful emotional experiences as we try and make sense of what we're going through, what we went through, and what this means as we move forward. It's confusing and it's not easy, and it doesn't always make sense. But when Dr. Van Londen gives me a name for what I was experiencing, when she said that what I just described was grief, I immediately felt a weight of relief. There was a name, a definition, and context for what I was experiencing. This is just one of the many examples we explore in today's podcast. I know you're going to love it. If this podcast resonates with you, please be sure to share it and tag Breast Cancer Conversations on social so I can read your comments and key takeaways. I can't wait to see you in the comments. Welcome to the conversation. So we are here today. We are so excited because we're actually hosting this podcast from Pittsburgh, Pennsylvania. So we're on the road and we are, and please correct me if I'm wrong, because I'm trying to put together, is it UPMC, the Hillman Cancer Center, also in connection with McGee's Institute?
Correct.
Okay.
Thank you for having me, Laura. This is the University of Pittsburgh Medical Center, and our main cancer center is called the Hillman Cancer Center, but it's spread throughout the city as well as far into the community. And so one of their sites is here at McGee Women's Hospital, where we treat women's cancers.
Yes.
And so that's where you're at today. My name is Dr. Josie Van Londen. I'm an associate professor at the University of Pittsburgh. I'm a medical oncologist, and I see patients in the Survivorship clinic, as well as I have another specialty clinic where I help newly diagnosed older patients personalize their care in a way that we hope the cancer won't bother them, nor the treatment. The focus is more on keeping them comfortable rather than going for cure.
Obviously, you have your hands full in a lot of topics then, in terms of survivorship, oncology, working with different newly diagnoses, and then also survivorship programs. So our organization is Surviving Breast Cancer. It has the word survivorship in it. I know that a lot of hospitals right now are developing or enhancing their survivorship programs. And that can take on a variety of fields. I know when I was diagnosed, I went through like a 12-week program that my hospital had. We met once a month, and, it was very therapeutic to meet other people because a lot of times, healthcare is private. We don't really talk about it. We don't share it. And as oncologists, you can't connect me with some of your other patients. But in this community, it was saying, okay, everyone who's been diagnosed, we're going to have like a meet and greet. Please come once a month and there'll be food. And that was really great because I got to meet other women of different stages, of different ages, but we all got to kind of talk about where we were in our treatment phase.
So we started 10 years ago at UPMC with our survivorship program, really spearheaded initially by Judy Herstein, who is an administrator who had created an educational program, which at that point was really a pioneer in the field because survivorship is only gaining momentum in the last few years, I would like to say. Mm-hmm. And what she noticed is that there was a need for clinical care too, but she had a hard time finding somebody who could help with that. And so from that angle, we actually bumped into each other. I'm a geriatrician too. And so on top of that, I'm a cancer survivor myself.
Oh.
And so I'm very used to and comfortable with treating patients that have multiple things going on, which is what survivors often have. They have many lingering post-treatment emotional, physical, functional, financial, fertility needs. They're not sure how to coordinate their care. They're not sure how to take care of their health.
Yes.
Because what they did before, they're wondering if that was right or wrong, how to fine-tune that. They may be concerned about whether they're hurting their body or not. They're not sure how to pick up their health maintenance. And so that is something we started 10 years ago, a survivorship clinic where we help individuals exactly with these random issues. We don't have a set agenda. Mm-hmm. We means me, listen to what the patient has to say. And then as we talk, I will discover what they may need that they didn't think of, or they may think of other questions. So our appointment time is a little longer, mm-hmm. and we have the time to bounce back and forth and come up with a treatment plan that I type up for them exactly with the homework items. This is what we discussed. And these are some things you can do for yourself. And so most people find that very helpful as a piece of paper you plug into your refrigerator and they can check it off as they go. Yes. So they feel like somebody has an overarching look at all their pieces, including referring them back to their primary care provider that the many survivors may have forgotten to do because they're so overwhelmed with seeing their cancer doctors.
Absolutely.
And so they feel like they're being pulled together and given a momentum so they know how to take care of themselves.
So typically it's on an individualized basis. So they're attending your clinic and it's one-on-one still.
Yeah.
Okay. So they physically make an appointment with you.
It's interesting. If you haven't been through it yourself, you can't really relate and you may not know what to say or do. Mm-hmm. And then some people, not intentionally, but may say or do the wrong thing, or the other way around, they may avoid you to some degree because they don't want to hurt you. And it makes you feel rather alone. Plus your priorities may have changed with such a, for many people, rather scary, traumatizing diagnosis. Your priorities may have changed. You're trying to reflect on, what do I really want to do with my life? And your previous friends, sometimes even your family members may not necessarily know where you're coming from. Like, who are you? You've changed a little bit. And that might be a little bit isolating to not be able to relate to the people you used to relate to. And so sometimes it can be very relieving to be able to connect, even with strangers. The kindness from strangers can be sometimes so validating or heartwarming. It's strange.
It is strange.
Yeah.
And wow, I'm going to feel like emotional here. I feel like I just made an appointment to talk to you and have my own one-on-one counseling. Exactly. Everything that you just mentioned is exactly what we go through. And the description that William just described, a lot of us who are estrogen positive are on so many different types of hormonal therapies afterwards, whether it's tamoxifen or an aromatase inhibitor. I myself am on letrozole, which is one of the aromatase inhibitors, and I get that plus a Lupron shot to suppress ovarian suppression. And what I never really realized, or maybe it just wasn't explained, or if it was explained, after the word cancer, I just stopped listening. But when you deplete your body of all of this estrogen, you're actually changing a lot of the chemistry that's going on. And so I'm driving to work. It's a beautiful day. The sun is out. The sky is blue. And I am losing it in the car for no reason. And, I share that context because, this it's hard to place like what those triggers are, what sets you off, what makes you tick. Walking down the street and looking at like a Lululemon stop, and you see all these mannequins, and I'm like, oh my God, the mannequins have breasts and they look great in those clothes. Like, it's ridiculous. But then, we find each other, we find other survivors who can relate to these things. Mm-hmm. We have a good laugh about it, and you don't feel so alone.
Well, humor is a very healthy coping mechanism. But there's different coping mechanisms. You can deal with the different feelings you have. But anti-estrogen therapy, which is what you're on, can really throw your body for a loop. It deprives your body from estrogen, just like when you go through the regular menopause, your estrogen level drops a little bit. But some of the treatments we're giving you drops it down even further to almost level 0. And so that can have different effects on your body. One of them can be menopausal symptoms, sometimes more pronounced than you would have had them if you went the natural way. In particular, if you do it pretty suddenly, abruptly, you can have hot flushes and night sweats. You can have mood swings. You can be a little irritable at times. Vaginal dryness is another symptom that then trickles through. All of these symptoms can trickle through in your relationship with your loved one. So those are common symptoms for most of the anti-estrogen therapies. And then each particular anti-estrogen therapy, we have different flavors, if that's how you call them. They can have their own unique side effects. And that's where it boils down to you sitting down with your doctor and trying to talk through what are the options and what might be best for you. Most of the patients feel like when they've heard the word cancer and they're basically starting on a train that they cannot come off. They're being told, and whether you're scared or in denial or you just don't feel like you know enough and you should trust your doctor, for one way or the other, it's like one treatment after the other. You don't really take a breath. There's not often the time or opportunity to do so, to think about, is this really what I need? But when you get to the point of anti-estrogen therapy, often there you have a little bit of luxury of time. There's not such an urgency to it that you can think your way through it, in particular because a treatment like that, you're staying on it for 5 and now evidence is starting to say maybe even longer than that, 7.5 to 10 years. And so that's a treatment you're going to take for a big portion of your life and may cause some long-term side effects too, that you can take the time to think it through with your doctor, with your loved ones, with yourself, to see what is best for you, weighing the pros and the cons, the benefits and the risks. Do I make sense?
What are some of the longer term risks? I guess it depends on the particular drug, but are there?
Correct. So one of the common side effects of an anti-estrogen treatment, for many of them, they can accelerate your bone loss, meaning your bone density of your bones may go down a little quicker than it would have otherwise. Not every woman responds the same way and not to the same degree, but pretty much most women lose a little bit of bone density, which you don't really notice until at some point there is a trigger, if you may, that may then result in a fracture, because the lower your bone mass is, the higher is your risk of breaking a bone if you should fall, or even increasing your risk of developing a fracture with a very minimal impact. And so those are one of the long-term side effects that we should keep an eye on. We tend to do a baseline and over time bone density scan that checks out how thick or thin your bones are and how fast that changes over time, so that there are ways we can intervene with either bone medications, or if really needed, we can sometimes change the anti-estrogen therapy around to one that may actually stimulate your bone mass.
Oh.
Do that make sense?
Absolutely. I think I had an initial bone density scan myself right before going on to letrozole. And then I also get Zometa infusions every couple of months, again, to help support the bone health. So that's just some examples of what I personally am on.
Correct.
So,
and that can compensate for the acceleration of the bone bone loss, so that long-term damage will be a little less than it would be otherwise. Plus, we know from studies that the bone density can recover when you come off the anti-estrogen therapy. Okay. So it may not be an as severe long-term side effect as many people are concerned about. It's often that your benefit from being on the anti-estrogen therapy is outweighing the risk of your bone density for the average woman.
Okay.
But this is something you have to talk one-on-one with your doctor based on your individual circumstances. What is in your best interest?
Sure. Another side effect that I'm hearing from community members when they're on these anti-estrogen pills are being thrown into menopause. Mm-hmm. And then all of a sudden over time, like they're losing their muscle mass, they're gaining weight in areas that they used to not gain weight so much. And, we joke all the time saying, wait, we're still in our 30s, but on the inside, we're like 85, and really trying to struggle with, this new identity, life after breast cancer. Yeah. We want to work out, but a lot of times too, we have severe joint pain or stiffness. And so it's really hard to kind of, I don't want to say overcompensate, but kind of get over the hurdle instead of throwing in the towel and saying, okay, well, I'm just not going to do it. We do know that, maybe it's getting in the pool, something a little bit like less high impact. Or I know I had to be very gentle with myself too, to say, you used to be really great at yoga before cancer and you had to take a year off because you were going through treatment. So now when you're going back, it's okay to start at the beginning and build back up again.
I like your way of thinking. You've obviously done some
some soul searching over.
Part of what you're talking about is grief. You're grieving for who you would have been if you weren't hit by your cancer, if you didn't need to go through the treatments you've been through. So part of that is grief for yourself, but also for other people, because most of the time what you went through has a ripple effect. Yes. For the people around you too. And so there's almost a sense of mourning, but then usually over time, and if an individual needs a little help with that by talking with somebody, then I truly hope that you won't feel embarrassed or ashamed, because it's very normal. Almost every cancer survivor, if not every cancer survivor, will hit a wall at some point where they're wondering, like, what did I just go through and what is going to happen next? So if you need a little push in the back by talking with somebody, I hope you would allow yourself to do so. But then over time, I noticed that some of my patients feel a little pressure to catch up on the time they lost when they went through treatment. They don't know how much time they've left. So then there's that pressure of, I want to squeeze the rest of my life in the next 1 year, or whatever goals they set for themselves. There's that huge pressure also to try and reduce the cancer recurrence risk, because you get hit over your head with everything that you can control, your exercise, what you eat. And that puts a lot of pressure on a cancer survivor in terms of, now I have to do all of this.
Right. It's a full-time job. It feels
that can be rather stressful. And so one of my tasks when I talk with somebody who I hear this pressure in, I'm trying to put it in perspective. Everything. One of them is the fact that they try to control their health and their recurrence risk. I try to tell them if and when the cancer should reoccur. There's many factors involved to that, not just your lifestyle. Many things in our body black box that we still don't understand, even though we're in the 21st century. We still don't understand which exercise is the best to prevent anything from coming back. We're getting there, baby steps at a time, but we're still not sure how much exercise, which diets. We still don't know. And so what I tend to usually tell my patients is moderation, variety, and common sense. Don't overdo it. You also deserve to have a quality of life. You're still a human being. It doesn't have to become a punishment for you. So those are some of the things I try to put in perspective. And then there is these existential issues like, how much time do I have left? What I want to do in the time that I may have left. Nobody really knows how much time I've left. So it's all very abstract and sometimes can throw somebody for a loop. Most people do this based on your development stages, and not until you're in your 60s and your 70s. You look back on your life and you make up a balance sheet of everything that went well and went wrong. But a cancer diagnosis almost torpedoes you into that phase. Like you're being forced to reflect a little prematurely when you're
We're in menopause now, and now we're reflecting prematurely.
Yeah, I don't mean to scare people, but I'm hoping it will recognize.
Yes, it makes so much sense.
And so you're in the development phase, and people in their 30s, 40s, 50s, they're supposed to build their life.
Mm-hmm.
And while you're doing that, and if you're younger, there's other development issues. But where I'm going with that is wherever you are in your development phase, the cancer diagnosis almost torpedoes you into the final development phase, and you're making up a balance sheet of your life. And that sometimes can lead to a degree of desperation, wondering, I didn't do everything I wanted to do yet. What is my legacy going to be? And so helping somebody to find peace with that, make peace with that, to forgive themselves and others for certain things, prioritize their life, compromise, knowing that you can't do everything, but don't let perfect be the enemy of good. It's these little baby steps that don't change really who you are, but might change how you stand in life. And then it's my sense from my personal angle, as well as what I see in patients I work with, is if you prioritize and stand differently in life, in the end, you actually gain time because you really focus on what is relevant. Does that make sense?
That is very inspirational. It's a great lesson to be. I'm watching Laura get emotional over here from the sidelines.
Okay.
But it's a wonderful lesson to reach out to the cancer community and just to say, this is what you're going through and most of this discussion has been from a psychological perspective. Now, you mentioned 2 points earlier that I wanted to touch upon. Mm-hmm. And one of the points was they're actually fairly related. Going into that post-treatment stage, a lot of the friends and a lot of the family feel that you're cancer-free now, that you've rid yourself of that, and that you don't need our attention and respect and love and caring anymore. And then the other piece, which is kind of associated with that, and we see it a lot when we do breast cancer conferences, we'll have strangers walking up to us and we'll just be staring at our booth and looking at things. And you can see they're getting emotional. And I'll just kind of reach across the table and say, can I help you? And this is not an unusual response. They say, I'm lonely. And so I'll just walk around the table and just give them a big hug just to say, you're part of our group. Just join our group. This is a virtual community. It doesn't cost you anything except your time. So if you want to participate in things, you can. And it's just a really supportive function that we're offering. And the psychological perspective that you bring to the table is just that. It's a wonderful place for them to invest in.
I tend to ask most of my patients at the end of the visit if I'm allowed to give them a hug.
Oh, yes.
And, asking permission.
Of course.
And so for me, that's very important. Yeah. But I think for them, it's very important too, that we're together trying to figure this one out.
Right.
And nobody has the magical answer, but correct. When you're going through treatment, most family members, loved one, neighbors, people at your work, your boss, may be very understanding and supportive. But then the minute you finish your treatment, your active treatment phase, they think, okay, your treatment is done. You should be better. Let's move on. And oh, by the way, here's your pile of work that you're backed
100%.
up on. And that is just suffocating by lack of better wording. Because you're still sitting on the floor with your eyes spinning like a tornado just spit you out. What just happened with me? You're still trying to catch your breath in any sense of the word. Physically, you're still not quite there yet. Functionally, you're not. Emotionally, you're not. Your treatments may not be done. The active piece of it might be. You still have lots of office appointments to go. You're just still, you're in the beginning stages of of healing.
Healing, exactly.
And that is going to take its own fair share of energy, time, and effort that you don't always allow yourself the time for, nor do others.
Mm-hmm.
And so then many patients tell me, survivors tell me that they feel embarrassed or ashamed or weak, that they just can't pull themselves together and do this. And they should feel grateful that they've gone through this. So why are they complaining? I mean, yes, you can be grateful if that's a feeling you have, but it doesn't mean you cannot complain. And oftentimes it's not really complaining, it's just reporting what it is.
Exactly.
And if you speak out that way, then other people, including your providers, have a way to reach out over the table and help you. If you don't say what's going on,
right,
then people don't get it. And now there's more and more resources online,
mm-hmm.
And the medical community is becoming stronger in terms of advocating this to many of our colleagues, so that when they get asked to help with paperwork for employers, then hopefully that all will trickle through, one baby step at a time.
That's a really great point. I'm really glad to hear that you are kind of advocating and working with patients on all of that paperwork, especially with employers. I know that transition going back to work after taking a leave of absence for some time is very overwhelming. Yeah. Everyone's happy to see you, you're back. And then all of the work is like, you're back. Yay, here you go. And, I remember all the self-doubt that bubbled up for me after going through these toxic treatments. You're not as sharp as you were. Right? This idea of the chemo fog, the chemo brain.
Yeah.
And I was triple checking everything I was doing, rereading emails because the words weren't at the tip of my tongue. And that became frustrating, right? It's very easy to fall into this like negative spiral of self-doubt and competency, but just reminding yourself and being kind to yourself as you're suggesting you're still healing.
Yes.
And oh my God, I was in a meeting having a hot flash. So embarrassing. Mm-hmm. But then, you turn it into a comedy. At least that's what I was doing, where I'm like, don't worry, guys, it's not you, it's me. Like, we're on these hormones and you can't control how much you sweat sometimes.
So explaining helps,
yes.
Including the fact that sometimes you might be a little emotional. Sometimes you may be very happy. Next moment, you might be a little tearful. Next minute, you might be a little irritable. If you explain that, it may help people around you understand. But at the same time, people feel like it might be used against you. And so it's a very delicate, everybody has to decide in their own environment how comfortable they are sharing. And for some individuals and some of my patients, it has meant that they found work elsewhere. But that's part of listening to yourself and finding a life that works better for you. It may not have been a good environment for you to be in to begin with.
Right.
But what I'm hoping, similar is after pregnancy or after any major event in your life, sometimes it becomes a little bit more clear what you're happy with and what you're not happy with in life. And you might at times, I don't want to use the word impulsive, but you might make decisions quicker than you would have otherwise. And after cancer treatment is one of those other periods in your life that it becomes very clear to you which things you don't really like and which things you really would like. And so I usually tell my patients, just write it down, think about it, process it. Unless you're not in a safe or actually in a dangerous situation, then maybe you should move a little quicker. But other than that, I would say let it settle for a little bit. Keep talking with yourself and the people around you. So that I know a lot of people feel the time pressure when it changes like yesterday. But we want to make sure that what you do is still what you want in the long run. On the other hand, some of my patients, and I know we're talking mostly about emotional stuff, but
that's great.
So, it
validates a lot of our listeners in our community. I think it's just comforting to hear, like, we all go through this.
And then some patients wonder, if I don't change anything, I didn't really learn anything from this. I didn't take anything, the silver lining. But what is the silver lining for me, for people who try to look at everything to have a good and a bad side?
Mm-hmm.
It takes some time to find the silver lining. And so just take your time, be nice to yourself. The other thing you mentioned, Laura, is brain fog. A lot of people used to call it chemo brain, but we've recognize that is a misnomer. There's more than just chemotherapy that can throw your brain function for a loop. It's even studies have shown that before you start your cancer therapies, after you've been diagnosed with cancer, your brain function can already start to change.
Oh, wow.
And so people are now investigating, studies are ongoing by some pioneers in the field, is that because the tumor is secreting inflammatory, who knows what, that circulates into your body and goes to your brain? Is it because you're stressed, you don't sleep well, you start eating differently? And then often you need multiple procedures with sedation, anesthesia that may throw your brain for a loop, and then chemotherapy, and then for some hormonal therapies, including men sometimes need anti-androgen therapies. You can go through a premature menopause. You sleep, you eat, you move differently. Some people become a little bit depressed or anxious, and all of that can throw your brain function for a loop. Some of us, the philosophy is maybe that the brain gets too many hits in a short period of time, and it just doesn't have a chance to catch up and recover. Another thing that gets often overlooked is that people may be at risk for sleep apnea, where their body doesn't get enough oxygen overnight. And then when they're going through their cancer treatments, they may gain a little weight, which then tips them over the edge. And then they may develop a clinical state of sleep apnea. And if your brain doesn't get enough oxygen overnight, then it just won't really function well the next day. And that can trickle through in memory issues and attention, concentration issues, in thinking itself. You may think slower, you may less be able to multitask. And you can have all these symptoms or just some of them. It's very subjective, because as of right now, we don't have clear screening tools. We do have them for dementia, but obviously these symptoms are you function at a higher level than somebody who has an early stage dementia. So these screening tools don't usually pick it up. We have to rely on what you tell us.
Sure.
But for some individuals, that becomes dysfunctional to the degree that they can't work their work, and some of them have actually been demotivated and had to be reschooled and change their career. So one of the things I look for is how much does it interfere with your function, because the more it interferes, the more I pull out of my drawer to try and help you. And that goes back to talking with the person. What is going on in his life? Is there a lot of, or her life? Is there a lot of stress? And that will dictate what we have to do. Usually I would draw blood work to make sure that there's nothing physical that we can fix, check certain vitamin levels, the thyroid function. Rarely I would order imaging of the brain. Sometimes I would send somebody to have their brain function assessed. It's a test of a few hours where they make you do tests that tell me how severely each part of your brain is affected. That can help us then create a brain training program. And so it all depends on the situation. There's not a cookie cutter approach. The biggest evidence out of all of those in terms of helping your brain function is actually exercise.
Really?
There's the biggest evidence base that exercise seems to help your brain function. We don't really know why. Is that because the perfusion to your brain is better, or the perfusion to your kidney and your liver, the organs that remove the toxins from your body? But regardless, exercise seems to help your brain function. And it doesn't have to be a lot. Anything you do more today than you did yesterday is going to make you feel better as a whole with many of your symptoms, including your brain function. Does that make sense?
It seems to be the answer for everything, the exercise. I hear that a lot.
But then the problem is a lot of people can't move as well. And that frustrates them because they would like to move, but they can't. Just be kind to yourself and do what you can. We're not all meant to be marathon runners.
Right.
I will never be able to run a marathon.
Sure.
At least I don't think so. But just accept who you are.
Now, some of the intellectual exercises that we see for Alzheimer's or some
Brain,
dementia, brain malfunction or dysfunction, include like doing word games, Sudokus and math games and music and playing music, et cetera, et cetera. Can that play a role in that as well?
There's some evidence to say that helps. Again, we don't exactly know how much. I would suggest you do something you enjoy, because then that really distracts you from everything else going on in your world. And it also has some relaxation function that may help with your brain function. It takes the stress out of it. There are some brain training software applications that you can purchase. Some of them are rather expensive, and they ask individuals to when they start off with programs like that, to indicate what areas of the brain they want to work on and which level to start with. And many of my patients may have a little bit of a hard time doing that right. And so then they get a little frustrated in terms of it either doesn't work or it's way too hard. And so I'm generalizing here, and I'm not mentioning particular products. But if you feel you need a little bit more than what you can do with yourself, before you resort to programs like that, I would make sure you talk with your provider and see if maybe any of these need to be started under supervision, so you don't frustrate yourself. That makes sense?
That makes a lot of sense. I think I'm a culprit of downloading one of these apps.
Okay.
And because I heard another survivor who uses them. She plays these games all the time to help with, like, I think one of them was like, seeing birds or checking out like shapes, or like also utilizing peripheral vision, or just response and quick response to kind of, I think a lot of times too, like we're short for words, right? So like, how can we like have a quicker response time and things? And she was doing it. So I immediately thought, well, if she's doing it, I should do it. So I downloaded this app and I paid like a month subscription. I was so frustrated. So it's so great to hear, like, okay, I haven't gone back to it, but this idea of maybe having it being supervised, or talking to a medical professional to say, well, what are the tools that I should use to make sure that I'm keeping my level of like mental state being like as high as possible?
Correct.
Excellent.
Correct. And peer pressure is a good thing. It can sometimes also be a bad thing. I don't mean it that way, but just continue to listen to yourself where you're comfortable with whatever you're doing. And so going back to your question that the clinic we have is mostly one-on-one, that is correct. But we offer different activities within UPMC as well as with our community partners. There's some nonprofit organizations in Pittsburgh through which we organize more of a group setting education, a larger group, smaller group, including some of those workshops that you were recommending, that the 3-month trying to help you transition from the acute active treatment phase into the long-term treatment phase. We have different activities in the community throughout the year, which makes me feel very happy to live in Pittsburgh, because I know that not many cities have that many resources just yet. And then I think services that you provide are good for those people who don't have access to them where they live. So kudos to you for doing this.
I know we're pressed on time, so we'll keep an eye on things. One of the last things that I wanted to touch upon was caregiving.
Yes.
And I don't know if you bring the caregiver in to have little chats with him or her or whomever, or what advice would you give for an active caregiver?
That's a very interesting question, and I find it challenging for many, many reasons. Caregivers have a very important function, and I'm a caregiver as well, and so it makes it harder if your caregiver has health issues themselves, because then there's feelings of guilt that come into there. But there can be many feelings, from frustration to anger to, you can imagine negative feelings, but also positive feelings if you find a good way for it to flow, in terms of it's nice to be helpful to somebody else. So how can we help with that? Very rarely, and I wish it was more often, do partners come to see me in the clinic. And when they do, I really give them a big compliment for doing so, because I think they really want to hear and understand. Although at the same time, I always make sure that the patient knows that if they want to talk with me alone as for part of the visit, then that they should feel free to do so too, because there might be, that's why it's tricky. There might be things they would like to tell me that they don't want their partner to hear. They don't want to put all their burden on their partner. And so I always try to find a healthy balance between, how much attention do I give to the caregiver versus the patient versus the combination of them. But the truth of the matter is that caregivers are very important. They serve an important function in the community, and their number is actually growing. Some recent literature show that the people who are forced to work and take care of their loved ones, including their parents in this case, are really, really being squeezed and getting a hard time from their work. And so it adds another dimension in terms of us helping them with their work so they can take leave to help their loved ones so they can stay at home as long as possible where they often want to be. And so I don't think there are enough resources to help the caregivers and keep that dynamic as healthy as it can be, although in every relationship there are issues. It's healthy to sometimes have a little bit of a hiccup, but I think it's very important for the caregiver and the patient to continue to have an open dialogue. Don't let resentment build, and ask if you can go with your loved one to the appointment. Your loved one may say, maybe not necessarily the next appointment, maybe the appointment after that, or the other way around. And then everybody can be prepared, and it can go for all parties involved the way it should go.
Yes.
Do that make sense?
Yes. One of the things that we do as we're moving towards a virtual platform, we still host in-person like survivors, thrivers, and friends meet and greets. So as William was mentioning earlier, whether it's a paint night or a brunch. And early on when we were developing our organization, I got some pushback from those diagnosed with breast cancer saying, no, I want it to just be inclusive of just those who've been diagnosed. And my response was, there's plenty of those organizations that already exist. I appreciate the feedback, but this is going to be open to spouses, caregivers. Also, it's scary to show up somewhere by yourself if you don't know people. So, it was a risk that I took. But at our very first event, I laugh and smile as I share the story because all the women, we didn't know each other, on one side of the table, and all the men and caregivers are on the other side of the table. We're at a restaurant, so the women are talking about boobs, and we're like, do you want to touch my plastics, or what about this? And we're just like, we're curious. We want to know about implants. We want to know about deep flap surgeries. We want to know about the hot flashes and all of the stuff we're going through. So we're having a riot on one end of the table. And then the men are laughing just as loud on the other end of the table, hearing like, oh my God, my wife and her mood swings. And oh my God, the night sweats. Like we can't sleep in the same bed. And, it really just brought a level of like, we're in this together, and it's not just me and my wife, like you're going through this too. So I thought that was just very healthy. And William has done a great job kind of spearheading the caregiver piece of our organization.
Men, they don't, I don't know how to say this politically correct, but men don't always like to ask for help is, I think, maybe a safe way of saying it. And it doesn't mean they don't need help. But maybe we have to create programs that are unique for men and for caregivers in general. Just keep in mind it's a marathon. It's not a sprint. Yeah. You need to find a hobby. Most of us are so busy, and then by the time it's evening, we fall over, we sleep, and we do it all again the next.
Yeah.
No matter how much or little time you think it takes, you need to find something that really gets you, makes you tick, is what you said in the beginning. And maybe think back to your childhood. What did you really enjoy doing then? Is it more along the lines of sports or arts?
Right.
Something that keeps you going, passionate about something.
Yeah.
That is very important to claim yours.
Mm-hmm. Find the beauty.
Yes.
Yes. Find the joy.
It's not always easy.
Mm-hmm.
Some days might be better than other days, but you don't always have to smile.
Right.
Just be you.
Giving ourselves permission for it to be, what's the phrase? It's okay not to always be okay.
Yes.
Yes. I like that. Well, Dr. Van Londen, this has been a pleasure speaking with you.
Thank you. You're welcome.
I feel like, can we continue at some other point? I feel like we're just scratching the surface. Thank you all for tuning in and listening to today's episode. We release episodes each week. typically on Mondays. If you have a topic idea or would like to be a guest on our show, please contact me at laura@survivingbreastcancer.org. We love hearing from you. Please remember that the content here should not be taken as medical advice. The content here is for informational purposes only, and because each person is so unique, please consult your healthcare professional for any medical questions. Views and opinions expressed on our podcast and website are our own and do not represent that of our workplaces. While we make every effort to ensure that the information we are sharing is accurate, we welcome any comments, suggestions, or corrections. In no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship. Until next time, keep on thriving.